Hi class, my name is Alejandra Tellez and today is January 27th, 2021, and we will be talking about cerebrovascular accident. A typical patient presentation. Mr. Jensen and his wife are having breakfast one Saturday morning. Suddenly, he begins to experience slurring of speech and facial drooping on the left side of his face. Also, weakness in the left arm. Mr. Jensen is a 56-year-old male. He has a history of hypertension. His wife dials 911 quickly and the ambulance arrives right away. Now, what is a cerebrovascular accident? It is a blood vessel that carries oxygen and nutrients to the brain that is either blocked by a clot or bursts. A CVA is also referred to a stroke. We can break down the word and its meaning in two parts, and the first word that we have is cerebro, which means brain, and then for the second part we have vascular, which just means blood vessels, and right away we can see that we will be dealing with the blood vessels in the brain. Next, we will be looking at the etiology of the disease, which is the underlying cause of a CVA. And here we have two main causes of a stroke. The first one we will be talking about is ischemic stroke, and that is a blocked artery. And the number of reasons why that can happen is because of a heart valve problem, atrial fibrillation, endothelial cell dysfunction, and that means that there are irritants such as tobacco damage in the endothelium, and this is just the site that is prone to atherosclerosis. Another reason that this can happen is because of a traumatic injury to the blood vessels of the head or the neck. Next, we have hemorrhagic stroke, and this means that there is a leaking or bursting of a blood vessel in the brain. And this can happen because of uncontrolled high blood pressure, head trauma, an aneurysm, or abnormal blood vessels. For the background of CVA, we have a couple facts here, and the first one is that it is the third leading cause of death in the US. It occurs more often in African Americans, Alaska Natives, American Indian, and Hispanic adults. More than 795,000 people in the US have a stroke each year. 80% of strokes are ischemic. The risk factors for a CVA include being at least 55 years old, but at any age, a stroke can occur. It happens in both males and females. Also, we have a history of hypertension, smoking. If our patient does smoke, the risk only doubles for a ischemic stroke to happen. We also have diabetes and atherosclerosis. And finally, we have a previous transient ischemic attack, which is short for TIA. And that is a brief stroke-like attack that can resolve its own within minutes to hours, but it does still require medical attention to be able to distinguish it from an actual stroke. The pathophysiology we'll be looking at first is for ischemic stroke, and I had mentioned earlier that it is a blocked artery, and this leads to reduced blood flow. In the picture here, we can see that a part of the brain is turning kind of like a blue-gray tone color, and that is because there is no blood flow going through it. And we can further divide ischemic stroke into two groups, and we have an embolism, which is a blood clot that breaks off from one location and it travels to the brain. Another group that we have is thrombotic, and this emerges from atherosclerosis, and it is due to the plaque buildup and stenosis. Stenosis just simply means narrowing, and in the picture here, we can see that the plaque buildup is making the blood flow very, very hard for it to flow. And narrow blood vessels are caused by fatty deposits that build up in blood vessels or by blood clots that travel through your bloodstream and lodge in the blood vessels in the brain. The pathophysiology of a hemorrhagic stroke. Earlier, we had discussed that an hemorrhagic stroke is an artery that ruptures or bursts in the brain, and that is when blood from an artery begins bleeding into the brain. In the picture, we can see that the artery has burst open and the blood is out into the brain now. And this means that an aneurysm in the cerebral artery breaks open, causing bleeding around the brain. The pressure of blood on the brain causes brain tissue death. There is no blood to perfuse the brain cells and excessive swelling from the leakage of the blood in the brain. The symptoms of a CVA. One of the very first things we want to look at is the location of the stroke in the brain, because if the stroke happened on the right side of the body, then the left side of the body is affected. If it happened on the left side, then the right is affected. In the brain, we have the cerebrum, which controls movement and sensation, speech, thinking, reasoning, memory, vision, and emotions. The cerebellum helps coordinate muscle action and control fine movement, coordination, and balance. We have difficulty speaking, slurred speech, difficulty walking, instability or paralysis of one side of the body, blurred vision, face drooping, numbness of the face, arm, or leg, especially on one side of the body. To diagnose a CVA, we have a couple of methods here, and the first one we will be looking at is a CT scan of the brain, and this shows bleeding in the brain or damage to brain cells, and this helps to find a location of the stroke. And we will be looking at a CT scan in our next slide. The next one that we have is an MRI, and that is magnetic fields that are used to find small changes in the brain tissue. Then we have a CTA, which means a computed tomographic angiography, and this is an X-ray image of the blood vessels. Next, we have an MRA, which is a magnetic resonance angiography, and this is to check blood flow throughout the arteries. Lastly, we have an electrocardiogram, an ECG, and this records the heart's electrical activity, which can show any irregular heart rhythms. Here we have a CT brain scan. So the first image all the way to the left, we have a normal brain scan. In the middle, we have an ischemic stroke, and there's an arrow pointing to the blood clot, and it's the little white part that you can see towards the middle of the brain. Next, we have the hemorrhagic stroke, and that big white area is all the blood that has leaked into the brain. For the treatments of a CVA, this varies on which type of stroke a patient has, so we really want to be careful with what we use to deal with the stroke. For ischemic strokes, there is a tissue plasmagen activator, which is short for TPA, and this is a clot-dissolving medication. We also have a thrombectomy, which a catheter is threaded up through the blocked artery in the brain, which suctions the blood clot out. For a hemorrhagic stroke, we have a surgical procedure called a craniotomy, which is an option when the patient life is threatened because of the pressure that affects the brain. And it is an open skull surgery to remove the blood. And we also have an anti-hypertensive drug, and this lowers blood pressure. Ways to prevent a CVA include a healthy lifestyle, to stop smoking, to make healthy food choices, maintain a healthy weight, and be physically active. These are the resources that I use to research and create my PowerPoint. If you guys have any questions, feel free to send me an email. My email is down below. Thank you.